All right, JAG University, Ozzie, just feels like the theme with health insurance is that no matter what, it's not if, but how much it's going up, right? We just talk about percentage increases. It tends to be the norm, and it's the acceptable thing. It's a difficult word. Acceptable thing to kind of happen. Give me some tips of how employers can not only mitigate that increase and, God forbid, to actually save money on some of their health plans.
I think the biggest thing to understand is why is there an increase? Basically, medical trend on average, which is cost of tools, cost of hospital stays, that actual industry of medicine has an average trend increase in cost anywhere between 10 to 12% a year. So as that's way above inflation.
Right.
If inflation's around 4% and you're growing at 12% in cost, something has to give. So the consumer or the employer is the one that pays the brunt of this with the health insurance piece. I think the biggest thing too in today's society is the carriers are pushing towards this level funded product. You have three types of insurance. You have community rated, which is fully insured, which it is what it is.
That's no matter what. That's a per person basis, usually under 50 employees, correct?
Under 50 employees. If you and I have the same company, same demographics, same amount of employees,
It is what it is.
and we have the same plan, same price.
So let me ask you, but do you have any negotiation type, I guess, power on the renewal?
On the renewal on under 50, there is no power to negotiate. Now, if you do level funded, which is a hybrid product between fully insured and self-insured,
When we talk about, just to be clear, self-insured means you as an employer have some skin in the game, right? As far as a deductible or retention per claim.
correct.
Okay.
So if you spend more in self-insured than you funded in claims, you as an employer owe money back. So level funded is the bridge of those two. Level funded, you're keeping a percentage of what you don't spend, but you're not keeping anything or losing anything if you go over. If you spend more in claims than you funded, what ends up happening is they're going to do an underwriting analysis based on your group as an individual group and say, this group's healthy, those outlier claims, we're not going to give them a large increase.
So it also shows that you do have some I say the word again, but some skin in the game as far as like the actual claims, right? And how much of that is education and kind of approach as an employer? Because so many employees look at, hey, it's health insurance, the insurance is free, right?
Correct.
And then so many things we talk about claims management. And again, there's outliers, like you mentioned, there's things that you cannot control. Like you cannot tell somebody, hey, do not use the health insurance, right? That's what it's for.
Correct.
But what are some like little tips that you can help just enforce as far as like a cultural standpoint to help mitigate those losses in 12 months?
One of the biggest things we do in our educational piece in our open enrollment is we teach people that if you're going to ER, it's a life or limb threatening emergency. You're going to the ER room, to the emergency room, with the intention of getting admitted to the hospital. If you're not going with the intention of being admitted, then you shouldn't be going to ER. That's what urgent care is for.
Right.
And one of the biggest things that we learned during the COVID era was telemedicine. Why don't we use it more? Why don't we have access to it? So all the carriers have telemedicine partnerships where you can literally open your app, click telemedicine, talk to a doctor. If he says, hey, looks like you might have strep throat, I'm going to send you this medication to the CVS.
Go from there.
Go pick it up.
Yeah, I mean, but that little change, and it happens a lot on the workers' comp side too, from an education standpoint. You get hurt. I like the example of life or limb, ER. If not, go to the outpatient center, right?
Correct.
Or urgent care. I mean, but why? Right? It's the actual bill you may not see or get quote unquote reimbursed out of your pocket. I mean, the ERs are billing. What do you think the percentage
On average,
on average?
an ER is billing around $10,000 per visit
When
to the insurance company, and you're paying your copay.
Right.
You're not feeling it.
You're not seeing those dollars until that claims analysis comes in 12 months.
Now, on urgent care visits, usually between $1,000 and $1,500, and you have a lower copay. So you're saving money on the copay, you're saving your employer money on the claim side. Another big proponent of cost of insurance is, let's use Baptist Hospital as an example. Well, Baptist is one of the best facilities we have in South Florida, but people don't know. If you walk through the main doors, the billing structures with the insurance carriers are different than if you walk through the side doors, which is the medical arts building. A surgery in the main doors might apply to your full deductible, but the medical arts building might be a third of the price.
That's interesting. I didn't
And
know
you could still use the same doctor, and it's basically the same facility. The only difference is how it was coded from where the location is.
So I mean, and how many? And that's a billing issue too, right? That's also a billing discrepancy. Like that little tip. But how hard is it, or is it as far as upfront educating the employers for the employees? I mean, that can't just be done on the first open enrollment, right?
No.
This is kind of that manual education piece as far as the overall service of the account.
One of the other things we say during an open enrollment meeting is there is no such thing as an MRI or as an outpatient surgery that isn't pre-scheduled, because both of those things have to be pre-scheduled. The only times that you're not doing something pre-scheduled is if you get admitted to the hospital or you have an inpatient surgery. Because if you went into the hospital through ER with appendicitis or gallbladder attack, you're being admitted and you're having surgery. So that was an admission and it's an inpatient surgery. That's something that was an emergency that turned into an inpatient stay. But if you have an outpatient surgery, there's no reason you can't give us a call. That's what we're here for, to advocate for you and help you find the best place to do it. Let's use a common surgery, a shoulder surgery. If you have a shoulder surgery in a hospital facility, it's going to be significantly more costly than a freestanding facility. You have Galloway Surgical Center on Sunset and 87th that does all types of surgeries, and it's significantly cheaper for the insurance company to pay a surgery there than in a hospital facility.
See, but so many times maybe employees might think, well, that's why, again, going back to this is what I have insurance for. But no matter what, how much your employee is contributing to your plan, that overall mindset of claims management and basically coming together to protect that claims ratio can save you money down the road, right?
Of course.
This is all about, obviously not just falling into this trap where, it's going up 10%, cut coverage, filling in with a gap plan. There's so many things that I think we got to kind of, and we're doing it right through conversations, through education, through advocacy about, the overall performance of the account to help potentially save you money and kind of, brace yourself for that looming increase.
Well, we could use ourselves as an example here. Last year we had a over 50% renewal, and this year we had a 5%. What's the difference? The education of how to use the plan properly.
And why those little things down the road can overall help save you money. It's not just the employee, the business owner saving money in the health insurance. It's not that. It's you're stuck in the middle of having to, basically navigate through all these little landmines that affect your overall insurance cost.
Well, I think one of the biggest things too is people don't realize if the employer's saving money, in turn the employee's saving money, because whether the employer pays 100% of the employee or not, they usually don't contribute to dependents. So if the employer's costs went up on the employee, then the dependent's costs went up for the employee.
Right.
So
it's all relative and so much stuff about, I think you hit on the head, education, implementation, that ongoing service about why things the way they are, and that the system exists, right? It's about opening up that communication to everybody to kind of be inclusive and try to help, not do the right thing, but help look at the overall cost aspect that could happen with all these claims and how to manage it.
Correct. And that's what sets us apart, the service side.